My name is Kim Williams. I'm a principal consultant with Health Management Associates, also known as HMA. HMA is a national health and research consulting firm, and we focus on improving the administration and delivery of public health, healthcare, and social service programs. Just by way of background, I am a social worker with over 20 years in behavioral health, including in behavioral health crisis. And HMA is supporting the Mississippi Department of Mental Health and its efforts to enhance the state's crisis response system. We are partnering with DMH on these monthly trainings online for all of you, as well as monthly provider convenings that I hope you will all join. So, again, thank you for being here, and also just thank you for the essential work that you do and for taking the time to strengthen your skills and approaches. Next slide. So here we are for our training on safety protocols when responding to behavioral health crises. Next slide. Let's just quickly review the learning objectives for today. One is that we're going to talk about building a comprehensive RAP plan, so understanding how to create individualized, action-oriented plans that support safety and continuity of care. We're also going to talk about identifying best practices for maintaining crisis responders' safety during crisis interventions. We're going to determine when and how to involve law enforcement or other partners in a co-response model. And then we're also going to talk through modifying crisis response strategies to address the unique needs of particular individuals. And then we'll have several opportunities throughout for you to interact through chat and through polls. Moving on to the next slide. Okay, so let's dive into objective one, building a comprehensive RAP plan. You can go to the next slide. So first, let's talk about what is a RAP plan. A RAP plan, also known as a Wellness Recovery Action Plan, is a personalized, strength-based tool that helps individuals manage mental health challenges and crises. It is collaborative, meaning that it's built with the individual and their support system. It's preventative, it identifies early signs and coping strategies, and it's actionable. It includes clear steps for crisis response. A strong RAP plan reflects the individual's voice, their preferences, their strengths, as well as their lived experiences. And it also reduces uncertainty during crises and improves outcomes by giving responders a clear blueprint. So just to help frame this, imagine that you're entering a crisis situation with no information versus having a document that tells you what calms the person, what triggers escalation, who they trust, as well as what interventions have worked or failed in the past. That difference can completely change the trajectory of the encounter. Next slide. So now let's talk through the core elements of an effective RAP plan. Each of these elements helps create a clear, actionable roadmap for supporting someone through early distress all the way to a full crisis response. First, we're going to look at triggers. So, these are events, situations, or interactions that may lead to distress or destabilization. They can be external, like a conflict with a loved one, or internal, such as, physical exhaustion. And identifying triggers early helps both the individual as well as the support team reduce exposure and intervene before escalation occurs. Next, we're going to look at early warning signs. These are, those subtle changes in behavior, thinking, or mood that signal things may be shifting. They could include sleep changes, irritability, withdrawing from others, or perhaps difficulty concentrating. And when we catch these signs early, we can put supports in place before a crisis develops. The third component is coping strategies. These are personalized tools and techniques the individual has identified that help them manage symptoms. So some examples could be grounding exercises, calling a peer supporter, or going for a walk, whatever has been effective for them. The key is that these strategies are practical, they're accessible, and they're individualized to the person. Fourth is the support system. This includes the people the individual trusts and feels safe with. Could be their emergency contacts, right? Clinicians, friends, community members. It clearly outlines who should be contacted, when to reach out, and what role each person plays. This ensures that nobody is scrambling during a crisis. And finally, we have the crisis plan. And this section outlines exactly what steps should be taken if the individual enters a crisis. It includes preferred interventions, communication preferences, what helps and what doesn't, and any safety considerations. This part of the plan, it reduces uncertainty and ensures everyone responds consistently and respectfully when things escalate. So together, these components create a proactive, person-centered plan that supports wellness, reduces crisis escalation, and strengthens collaboration with the individual. Next slide. Now let's talk through how to actually build a RAP plan. The most important thing to remember is that RAP planning is a collaborative and empowering process, right? We're not creating a document for the individual, we're building it with them. So you want to start with a person's voice. Begin by asking open-ended questions about what helps them stay well, what makes things harder, and what supports look like from their perspective. Their language, preferences, and experiences should shape the entire plan. Step two is to identify strengths and wellness tools. Before diving into crises, help them identify what keeps them grounded, right? Daily habits, coping tools, people they trust, activities that promote stability. These form the foundation of the plan. Step three is to walk through each component together. So, together, you're going to explore triggers, early warning signs, coping strategies, their support system, and their crisis preferences. This should be conversational, not clinical. Encourage the person to reflect on their past experiences. What worked? What didn't? And what do they wish would be different? Step four is to use clear, accessible language. Write the plan in simple terms that the person and their supporters can easily understand. You want to avoid jargon or avoid ambiguity. Crisis moments are stressful, and so clarity is essential. Step five is to decide where and how the plan should be stored. The plan needs to be secure but also accessible. So you want to talk with the individual about who should have access and how they prefer it should be shared. And then step six is to review and update regularly. Remind the individual that the RAP plan is a living document. It should be revisited after major events, like after a crisis or anytime they want to make changes. This keeps the plan relevant and effective. And so by taking these steps, we help to create a plan that is personalized, it's actionable, and it's centered on the individual's autonomy and safety. Next slide. When we build a RAP plan, the process matters just as much as the final document. It's essential that the experience feels empowering, collaborative, and grounded in respect. And so here's some key principles to guide that work. First is use trauma-informed language. This means choosing words that are calm, supportive, and non-judgmental. You want to avoid language that feels directive or clinical. So instead of saying, you need to, you might say, what would feel supportive for you in the moment? The goal is really to create emotional safety and help the individual feel seen rather than evaluated. A second is to respect values and preferences. Everyone brings their own cultural background, beliefs, and lived experience into the planning process. And so take time to ask about traditions, communication styles, family roles, or community supports that are important to them. Third is to involve family, peers, and community supports when appropriate. Many people draw strength from those around them. And with the individual's permission, you want to include these supports in the process. They can really help to offer insights, reinforce coping strategies, and play a meaningful role during times of crisis. And finally, you want to ensure the individual has ownership of the plan. This is their document, right? They decide what goes in it, who sees it, and how it's used. And so our job is to guide, not dictate. When the person truly feels ownership, the plan becomes more accurate, more relevant, and far more effective during a crisis. So these principles can really help create a plan that helps to build trust, it honors identity, autonomy, and strengthens safety, both for the individual and the responders who may support them. Next slide. Once the RAP plan is created, the next step is ensuring it's actually useful during a crisis. A plan only works if the people who rely on it can understand it, find it, and follow it when things are stressful. So, first is to use clear, jargon free language, right? The plan should be written in simple, everyday terms. In a crisis, no one has time to interpret clinical language or guess what a phrase means. So clear wording helps the individual and their support system, as well as responders, take the steps quickly and confidently. Second, store the plan in a secure but accessible location. We want to protect the person's privacy, but we also need the plan to be available when it's needed most. And so that might mean keeping a digital copy in a secure system, a printed copy in a safe place at home, or sharing access through a care team portal, whatever works best for the individual. Third is sharing the plan with the right people. With the individual's permission, the plan should be shared with the supports who may need it in real time. That could include crisis response teams, case managers, emergency contacts. The more aligned the support system is, the safer and more effective the response will be. And then finally, review and update the plan regularly. A RAP plan is a living document. The individual's needs, their preferences, and supports may change over time. And so reviewing it after a crisis, after a major event, it keeps it accurate, relevant, and reflective of the person's voice. And so these steps ensure that the RAP plan isn't just created, but it's actionable, it's accessible, and it's supportive in those moments that really matter most. Next slide. So we're going to dive into an activity for a few moments. And for this activity, we're going to practice identifying one component of a RAP plan based on a brief scenario. So let me read this scenario to you. Jordan is a 28-year-old who is currently experiencing a manic episode. He has a history of trauma and becomes agitated when he feels confined. He lives alone and does not have immediate family nearby, but he does have a strong connection with a peer support group. So, based on this information, I'd like you to reflect on Jordan's needs, his triggers, his support system, and take a moment, reflect, respond in the chat. What is one element you would include in Jordan's RAP plan? This could be a coping strategy, a trigger to watch for, a communication preference, a safety consideration, or perhaps a support person that he would want included. So take a moment, think about it. What would help Jordan to stay safe, supported, and grounded during future crises? And go ahead and add your response to the chat. Give you a moment all to respond. Support from the peer support group. Yes. Thanks for responding. Anybody else? Just give it another moment. Okay, so some things to consider here. It's noted that leveraging, his peer network, the PSR program. Some other things to think about is, giving Jordan his space, right? Avoiding confinement. That's really important to him. These are all kind of things to be thinking about in terms of RAP elements that really prioritize both safety as well as autonomy. Thank you to those who responded in the chat. Okay, we're going to move on to the next slide. All right, so just as we wrap up this section on RAP plans, there are just a few key points I want to reinforce. First, RAP plans are living documents, right? They evolve. Second, empowerment, collaboration are critical. Third, strong RAP plans help reduce crisis escalation and improve outcomes. And finally, tailoring the plan to the individual builds trust and safety. So these kind of takeaways, they highlight why RAP planning is such a powerful tool in crisis work. It really centers the person and strengthens safety and enhances their overall quality of life. Okay, next slide. So now we're going to move on to objectives 2 and 3, safety protocols and co-response. Next slide. Before we get into specific safety practices, it's important to ground ourselves in why safety protocols are so essential in crisis response work. These guidelines, they aren't just procedural, they actually directly impact the well-being of everyone involved. First, safety protocols help prevent physical harm. Crisis situations can shift quickly, and responders may encounter unpredictable behaviors or unsafe environments. Clear protocols help us assess risk, position ourselves safely, and make decisions that minimize harm to both the individual and the response team. Second, they reduce emotional and psychological stress. Responding to crisis can be intense. Having structured steps to follow responders and supports responders in staying grounded. It lowers their anxiety and prevents overwhelm. It also helps the individual in crisis feel more stable because the team is calm and consistent. Third, safety protocols enable effective intervention. When we're not scrambling or improvising, we can focus on using our skills, de-escalation, communication, as well as assessment, to support the person more effectively. Safety creates space for clinical judgment and compassionate connection. Fourth, safety protocols promote strong team coordination. Everyone on the response, peer supporters, behavioral health professionals, law enforcement, medical partners, they need to understand their role. Shared protocols ensure that everybody's on the same page, reducing confusion and helping the team move in sync. And finally, safety protocols help ensure compliance with professional and ethical standards. They align our work with best practices, legal requirements, and organizational expectations. This not only protects responders, but also reinforces accountability and public trust. So these factors highlight why safety protocols are not optional. They are the foundation of a safe, effective, and compassionate crisis response. Next slide. So in this section, we're going to walk through the core safety measures that guide how we position ourselves, how we communicate, and how we manage the environment during a crisis response. These practices help ensure safety for both the individual as well as the response team. So first, positioning. Good positioning is one of the simplest and most effective ways to reduce risk. So you always want to make sure you and the individual have clear access to exits. This reduces feelings of feeling trapped, and allows for a safe withdrawal if needed. Avoid standing directly in front of the person. Instead, use a slightly angled stance, which feels less confrontational and lowers perceived threat. Keep your hands visible and relaxed. Hidden hands can feel threatening, while open, neutral posture communicates calm and non-aggression. So these small adjustments, they really go a long way in helping the situation feel safe and more controlled. Next, exit strategies. Before you even engage, take a moment to plan your way in and your way out. Identify both primary and secondary exits in case the situation escalates. Make sure all team members know the escape routes and understand their roles if a withdrawal becomes necessary. And importantly, never block the individual's path. Restricting movement can increase the agitation or fear, especially if for someone already in a crisis. So having a clear shared exit plan protects everybody involved. Coordination among team members is also critical, especially when you need to respond quickly and discreetly. So establish nonverbal signals, simple gestures that mean, step back or slow down or call for help. Use coded phrases when verbal communication is needed, but you don't want to alarm the individual. And always confirm these signals during pre-briefs and debriefs to ensure consistency. These communication tools help the team stay synchronized without escalating the individual. The physical environment can either support de-escalation or add to the risk. So you want to start by removing or securing potential weapons such as sharp objects or heavy items. Assess the lighting, noise, and crowd presence, and reduce unnecessary stimuli whenever possible. And position yourself near neutral zones like doorways or open spaces rather than confined or cluttered areas. Managing the environment helps create a calmer, safer space for engagement. And finally, consider your own personal safety measures. Wear attire that supports safety. For example, avoid dangling accessories or items that could be grabbed. Carry minimal personal belongings so nothing becomes a distraction or unintended hazard. And if your agency protocol requires protective gear like vests or safety equipment, make sure you're wearing it before entering a high risk environment. These steps protect you physically and allow you to stay focused on supporting the individual. So these core safety measures help create a safer, more predictive environment for a crisis response. Next slide. Situational awareness is an important skill in crisis response. It helps us anticipate risk, respond early, and keep both ourselves and the individual safe. And it isn't a one-time assessment and something we maintain throughout the entire interaction. So let's walk through some core elements of effective situational awareness, which kind of reinforces what we talked about on the last slide. So first, when you arrive on scene, the very first step is scanning the environment. You want to identify those entry and exit points immediately so you know pathways in and out. You want to note any potential hazards like sharp objects, heavy furniture, or even a crowd forming around the situation. And you want to pay attention to lighting, noise, and space limitations. A quick kind of scan of the environment sets you up to engage safely and thoughtfully. Next, you want to observe the individual. Watch for both verbal and nonverbal cues, tone of voice, pacing, gestures, eye contact. Look for changes in posture or facial expression that might indicate rising distress or escalation. Often, behavior shifts before words do, so picking up on these early cues allows you to adjust your approach before things intensify. And then, as noted, situational awareness, right, isn't static, it's ongoing. So you want to continuously update your assessment as things change. Ask yourself, has the risk level changed? Do we need backup? Is this a moment to withdraw and reassess? Use team check-ins, even brief ones, to make sure everyone shares the same understanding of the risk level. This dynamic approach, it reduces surprises and helps the team make informed decisions in real time. How you position yourself is also part of your risk strategy. So you want to maintain a safe distance, usually about 2 arms length, unless closer contact is required. Avoid blocking exits or creating any sense of confinement. This can heighten fear, agitation. Always stay aware of your own escape route. Your movement should always support safety and reduce pressure on the individual. And then strong situational awareness includes strong teamwork. So you want to use your pre-agreed signals, keep line of sight with your team members whenever possible, and share quick updates, verbally or through discrete gestures to ensure everyone stays aligned. And then finally, situational awareness depends on your own readiness, right? Stay calm, focused, and alert. Your presence influences the tone of the interaction. Keep your hands visible and relaxed. And then limit distractions. This is, not the moment to multitask or shift attention away from the individual. So your intentional state shapes the external environment. Situational awareness, it gives us the ability to kind of see the full picture, right? What's happening, what's changing, and what's needed next. It's kind of the foundation of safe, effective crisis engagement. Next slide. Effective communication. This is really a powerful tool we have in crisis response. The way we speak, listen, and position ourselves can either reduce tension or unintentionally increase it. So let's talk through the communication strategies that support safety and connection. We'll start with tone and language. You want to use a calm, steady voice, right? Your tone can help regulate the individual's emotional state. So choosing simple, clear words, avoiding jargon, as we mentioned earlier, that could be potentially, be confusing during a crisis. And you want to speak in short, concise sentences to make information easier to process. In a heightened moment, clarity and calmness really go a long way. Next is active listening. This is essential for building trust. You want to reflect back on what the individual shares. So, for example, you might say, I hear you're feeling overwhelmed. That shows you're truly listening to the person. You want to validate their emotions without endorsing any harmful actions. So you might say, it makes sense that you're feeling really scared right now. You also want to avoid interrupting. You want to give them space to express themselves fully. Active listening really helps the person feel heard, which can lower intensity and support de-escalation. Non-verbal cues communicate just as much as our words do. So you want to maintain an open posture, right? Avoid crossed arms or anything that could feel confrontational. Again, keep those hands visible and relaxed, and use gentle eye contact, being mindful, not to stare or appear overly assertive. Your body language should communicate respect, presence, and calm. And there are also specific phrases that can help reduce tension and convey support. So some examples include, I want to understand what's going on. Let's take a moment to breathe. You're not alone. We're here to help. These statements, they validate the person's experience and reinforce that you're there for them, right? You're there as a partner and not as an authority figure. And finally, strong communication within the team is essential. Again, you want to use those discrete signals to indicate escalation, withdrawal, or need for assistance. When it's safe, confirm roles and next steps verbally, and avoid discussing sensitive details, in front of the individual, as this can create mistrust or escalate the situation. When the team is coordinated and communicates effectively, the individual experiences a more stable and supportive environment. So, together, these strategies can help create connection, reduce fear, and also support safe, collaborative crisis intervention. Now, let's go to the next slide. So, now we're going to talk about co response engagement, specifically when to bring in additional partners and how to coordinate effectively once they're involved. Co-response is a critical part of maintaining safety and ensuring the individual receives the right support at the right moment. So we're going to start with the question is when is co-response appropriate? Co-response is most useful in situations when the risks or needs exceed what a behavioral health responder can safely or effectively manage alone. So some indicators include imminent risk of harm to self or others. This could include escalating aggression, threats, or unsafe behavior, the presence of weapons or objects that could be used as weapons, medical emergencies such as overdose symptoms, severe injury, or acute health issues, and multiple people involved, or a high risk environment where crowd dynamics or surroundings create additional hazards. The goal here isn't to escalate force, it's really to enhance safety and add specialized support. You can go to the next slide. So continuing here on co-response engagement, and focusing on kind of, preparing for co-response and how to engage effectively. Once you determine co-response is needed, the next step is engagement, and that requires coordination and clarity. So first you want to pre-brief with partners. So before approaching the individual, take a moment to align roles. Clarify who's going to lead, who's going to support, and how communication is going to flow. And then maintain behavioral health leadership. Whenever possible, the behavioral health professional should guide the clinical and engagement approach, while partners provide safety and logistical support. And then use trauma-informed language. Avoid commands or authoritative tones that may increase fear or escalate the situation. Again, keep the communication calm and collaborative. And then share real-time updates. As the situation evolves, keep all responders informed so that decisions remain coordinated and consistent. Co-response really works best when everybody understands their role and also respects each other's expertise. And co-response does not mean overwhelming the individual with unnecessary presence or authority. So you want to avoid a show of force, right? For example, you want to limit the number of uniformed officers within the individual's direct view. And you want to position law enforcement in a supportive rather than a dominant presence, allowing the clinical staff to lead in communication. And then you also want to narrate changes as they happen. For instance, we're bringing someone in to help keep everyone safe. This reduces confusion and it helps the individual in crisis feel informed rather than blindsided. The goal is really safety with dignity here. And then finally, once the situation has stabilized, you want to conduct a debrief with all responders, Identify what worked well, what could have been improved. You want to document your decisions, actions, and outcomes for accountability as well as for learning. And then you want to note any changes that should have been made to the individual safety plan or crisis approach moving forward. So debriefing really kind of helps to strengthen the system and improve future response. So co-response is really effective when it's timely and it's coordinated and it's grounded in trauma-informed practice. When responders work together with clarity and with purpose, they enhance their safety, reduce escalation, and provide the individual with the most compassionate and effective support possible. Next slide. So before deciding how to respond or whether to escalate to co-response, we need to pause and make a structured assessment. This isn't about reacting quickly, it's about responding thoughtfully. So the first factor here is risk level. So we want to ask ourselves, is there imminent danger to the individual, to the responders, or to bystanders? We also assess whether there are weapons or objects nearby that could be used to cause harm. Even everyday items, chairs, bottles, metal objects, they can change the level of risk and the type of response needed. Next, we want to look at the individual's behavior. Are we seeing signs of escalation, such as pacing, shouting, clenched fists, or verbal threats? We also want to consider what we know about the person's history, prior violence, substance use, or trauma triggers. This context helps us anticipate how the situation may evolve and what approaches are most likely to escalate or de-escalate. The environment is also another critical factor, as we've talked about, right? Are there bystanders present who could be harmed or who might increase tension simply by watching or reacting? We also check the space and the layout. Do responders have that clear exit route? Are we working in a confined area where movement is restricted? These environmental constraints often dictate whether continued engagement is safe. We then want to assess available resources. Do we have backup nearby? Are there specialized supports available, such as medical responders or peer specialists or law enforcement partners needed? Knowing what support is accessible helps us decide whether to continue de-escalation independently or bring in additional help proactively. Legal and organizational protocols also need to be considered. Are there policies that require law enforcement involvement under specific conditions? Are there mandated reporting obligations that apply in this situation? These requirements don't replace clinical judgment, but they do shape our response options. And finally, we apply a trauma-informed lens. We ask, will involving law enforcement increase fear or re-traumatize the individual? And just as importantly, we want to ask, can we maintain dignity and respect throughout the intervention, regardless of the response path we choose? All of these factors guide us toward the least restrictive, safest response, one that protects everyone who is involved while also still honoring the person's humanity. Next slide. So when we talk about trauma-informed co-response, we're talking about coordinating with partners in a way that reduces harm, prevents escalation, and preserves the dignity of the individual, even in high-risk situations. And so let's walk through these principles. The first is prioritizing psychological safety. That means creating an environment where the individual feels as emotionally safe as possible, even when the situation is tense. We do this by explaining what's happening, avoiding surprises, and being transparent about next steps. Psychological safety lowers the fear, and lower fear essentially reduces escalation. The second principle is minimizing power imbalance. Co-response can unintentionally feel intimidating. You've got multiple responders, uniforms, equipment, authority. So whenever possible, behavioral health professionals should take the lead in that communication. Limit the number of visible responders and position partners in a supportive, not dominant role. The goal, again, is to avoid making the person feel surrounded or controlled. And third, we use respectful, person-centered language. Language matters. We avoid commands, threats, or labels. Instead, we use that calm, collaborative phrasing. For example, we're here to help, or let's figure this out together. That person-centered language affirms the individual's humanity and helps maintain connection during a crisis. Another principle is reducing sensory overload, right? We've talked about how in crisis situations we want to avoid bright lights, loud noises, radios, sirens, all of which can intensify distress. So, when possible, we want to lower noise, reduce visual stimulation, limit movement, and create that physical space. These small adjustments can have a calming effect. And then we also emphasize cultural and historical awareness. Many individuals and communities have experienced harm, discrimination, or violence involving systems of authority. Co-response must take that into account. And so this includes recognizing when the presence of certain responders may increase fear rather than safety and adjusting our approach accordingly. And then finally, trauma-informed co-response includes after-action care. So after the situation is resolved, we check in. We check in with the individual when appropriate and with responders. We asked, again, what worked, what didn't, and how the experience impacted everybody involved. Debriefing supports learning, accountability, and emotional well-being, and it strengthens future responses. So these principles really help ensure that co-response isn't just coordinated, but it's compassionate, it's effective, and it's respectful. Next slide. Okay, so now we're going to walk through a scenario around escalating community crisis and what to do in response. So we want to apply the concepts that we have been discussing. So first, let me read through the scenario for you. You and a teammate are responding to a call at a community center. When you arrive, the individual is pacing rapidly, shouting and knocking over chairs. They have a history of substance use and prior aggressive episodes. There are several bystanders nearby, and the individual refuses all verbal redirection. As you scan the environment, you notice a metal object on a nearby table that could be used as a weapon. This situation presents a number of key challenges, right, at once. We have behavioral escalation, environmental hazards, bystander safety, and limited responsiveness to de-escalation. And so, what action do you take in response to this situation? You have three options here. Engage co-response now, continue de-escalation, or withdraw and reassess. And there's no single correct answer. Each option reflects, different priorities and interpretations of risk. So we'll welcome folks to respond. Thank you to those of you who have put your responses in. I've gotten a couple. About 40% there. So give it another moment for folks to take a moment to respond. All right, I'm going to end the poll and I will share the results. And you will see here, for those who responded, we have a split. Half of you said engage co-response now, call law enforcement or a specialized partner, recognizing the level of risk. You think co-response is the right direction to go. And then the other half of you noted continuing de-escalation, using those verbal and nonverbal calming strategies to continue to de-escalate the individual. I'm going to stop sharing. Thank you all for taking the moment to respond to that situation. Again, no right answer. It kind of depends on different priorities and interpretations of risk. And so, your decision reflects kind of the conditions that are in front of you. Okay, we can move on to the next slide. Now we are going to move on to objective 3, adapting protocols for special populations. Next slide. Okay. So as we talk about adapting safety protocols for special population, it's important to focus on why adaptation is essential. Crisis response is not a one-size-fits-all process. The individuals we serve bring different backgrounds, needs, abilities, and experiences, and so our approach has to reflect that. So first, people experience crisis differently. So we have to take that into consideration that disability, trauma history, developmental needs, lived experience, cultural background, they all shape how a person communicates, responds to stress, and interprets our presence in responding. And so, because of this, rigid or standardized protocols, they're not enough. We need to remain flexible so our response fits the reality of the individual, not just ours. Adaptation is also a safety strategy. When we miss or misinterpret cultural cues, sensory needs, or trauma triggers, we can unintentionally escalate the situation. Tailoring our approach, whether by adjusting tone or reducing stimuli or involving culturally relevant supports, that helps prevent harm and keeps everyone safer. Individuals are also more likely to engage with us when they feel understood and respected. So, by adapting our approach to their preferences and needs, we communicate that we see them as a whole person, not just a crisis situation. This builds rapport quickly, which is critical in moments where trust can determine whether someone accepts help. And adaptation is also an equity practice. Groups who have experienced discrimination, systematic inequities, or negative interactions with institutions may approach crisis situations with fear or distrust. So, adjusting our response helps counter those barriers and ensures that all individuals receive compassionate, appropriate care. When we adapt effectively, outcomes improve. So people feel safer, interventions are more effective, and the likelihood of resolution without escalation rises significantly. Adapted approaches lead to more accurate assessments, better engagement, and more sustainable recovery. And then finally, taking an adaptive approach is central to trauma-informed care. Trauma-informed principles emphasize safety, empowerment, collaboration, choice, and cultural humility. And so adaptation brings those principles to life. It ensures that we respond in ways that avoid re-traumatization and support the individual's sense of control and dignity. And so adaptation matters because it allows us to meet people where they are, right? Um, okay, we can move to the next slide. So, when responding to behavioral health crises, it's essential to recognize that different populations have unique contexts, needs, and risk factors. Adapting our approach not only improves safety and engagement, it also ensures we're providing culturally responsive, trauma-informed care. So, here are four populations commonly encountered in a crisis response and the considerations that guide our work. So first, individuals on reservations. The context here is that tribal sovereignty and distinct legal frameworks govern crisis response in these communities. So when responding on tribal land, we want to involve tribal authorities earlier, and we want to respect cultural traditions and protocols which may guide communication or decision making. We also want to be mindful of historical trauma connected to government or outside intervention, which can affect trust and engagement. Building relationships with tribal leadership and community members is really essential for effective, safe response here. For people with developmental disabilities, the context is that individuals may have cognitive, sensory, or communication challenges that influence how they respond to crisis or direction. And so for this population, we want to use clear, simple language, incorporate visual aids or gestures when helpful. We want to avoid that sensory overload that can heighten distress. And we want to allow extra time for processing and response. So a calm, patient, low stimulation is key here. For individuals with substance use disorders, they may be experiencing withdrawal, cravings, medical distress, or altered perception during a crisis. And so effective engagement includes applying harm reduction principles, such as avoiding judgmental language and, recognizes some substance use as a health condition, offering non-confrontational support, and providing connection to resources, including detox, medical care, or peer support. Meeting the individual where they are, it supports safety and long-term recovery. And then for people experiencing homelessness, these individuals may be under high stress due to instability, a lack of safety, trauma, or unmet basic needs. So when responding, we want to address immediate needs first. And we want to avoid actions that could lead to displacement trauma. And we also want to build trust through empathy, validation, and resource referrals. These individuals may have, negative experiences with service systems, so trust building is really essential. Next slide. And so when we talk about adapting crisis response for special populations, it's not just about individual needs, it's also about understanding the cultural context and environmental conditions that shape a person's experience. So let's walk through, again, some key populations and the considerations that guide our approach. So for individuals living on reservations, it's essential to respect that tribal authority, and honor the governance structures that guide decision making. And again, understanding the role of historical trauma. Because of this history, trust has to be earned through respect, transparency, and collaboration with tribal leaders. Environmental factors may also influence response. Many reservations are in remote locations, which can delay emergency response, and there may be limited behavioral health resources that are available. For people with developmental disabilities, you want to recognize communication differences and sensory sensitivities and avoid making assumptions about cognitive ability. Environment plays, a major role here. We talked about, high stimulation settings can quickly trigger distress, and we want to provide that safe, quiet space. For individuals with substance use disorders, we want to avoid a stigmatizing language, and we want to understand the community's attitudes towards addiction. In many cases, the crisis occurs in public spaces that could increase the risk of confrontation, perhaps bystander involvement or legal complications. And also, responders must monitor for medical emergencies such as overdose, dehydration, or heat exposure. And then when supporting people experiencing homelessness, we want to be sure that we respect autonomy and we understand that distrust of service systems often stems from past negative or harmful experiences. Environmental stressors also are significant here. Lack of privacy and unmet basic needs can intensify agitation or crisis symptoms. Weather conditions, shelter availability, and personal safety concerns all influence crisis severity and urgency. So, recognizing these cultural and environmental factors helps us respond with humility, with greater accuracy, and also compassion. Next slide. When responding to a behavioral health crisis, the way we communicate can affect safety, trust, and engagement. Different individuals have different communication needs, and so adapting our approach helps reduce confusion and prevent escalation as well as build rapport. So we want to use plain, clear language, right? Start with simple, straightforward language that helps reduce misunderstandings and helps the individual stay oriented during a crisis. Um, the tone and speed of our speech deeply influence how someone experiences the interaction, right? So we want to keep our tone calm and steady. That right tone and pace helps regulate the moment and reduce emotional intensity. For individuals with developmental disabilities, sensory sensitivities, or cognitive challenges, visual or environmental cues can make communication easier. These small adjustments around gestures, visual aids, or pointing to objects, when helpful, they can really dramatically improve cohesion and comfort. Communication should reflect cultural humility and respect. So, using interpreters or cultural brokers, avoiding idioms or expressions that may not translate culturally, and just being mindful of cultural norms. So, adapting to the individual's cultural context helps them feel respected, seen, and understood. And then finally, always ground your communication in trauma-informed principles, right? Using validating, non-judgmental statements, narrate your actions to reduce fear or uncertainty, offer choices when possible to restore a sense of control, and avoid commands or language that could sound threatening. Trauma-informed communication that promotes safety and lowers the risk of re-traumatization. So effective communication, it's not just about what we say, right? It's also about how we say it and how it's received and how well it meets the individual's needs. Next slide. So in crisis response, trust is a really important tool. Without trust, individuals are not likely to engage, accept support, or feel safe enough to de-escalate. So we want to start with rapport. We want to begin by establishing that connection, setting the tone for a safe, respectful interaction. Even when we introduce ourselves, we might say, say our name, my name is, and I'm here to help, right? Use non-threatening body language and avoid rushing the conversation. This approach signals safety, respect, and genuine care from the very beginning. Validation is also a cornerstone of trust building. We want to acknowledge feelings without judgment. We want to avoid minimizing or dismissive phrases like calm down or it's not a big deal. Validation shows that we hear the individual, we see them, and we take their experience seriously. And trust grows when people feel they have agency, even in a crisis. So we want to offer options when possible. For example, would you like to sit here or would you like to sit over here? We want to explain next steps clearly and ask for consent when appropriate. Choice really restores a sense of control, which is especially important for individuals who may feel powerless or overwhelmed. Reliability also builds confidence and reduces fear. So following through on promises, right? I'll stay with you until help arrives. We want to be transparent about what we can and can't do. That clear, honest communication prevents misunderstandings and reinforces credibility. And then trust depends on cultural respect and awareness of trauma. So again, consider those cultural norms, avoid language or gestures that could trigger past trauma, and engage interpreters or cultural liaisons when possible. And then finally, trust grows through genuine empathy, right? Use active listening, repeat back key points to show understanding, and express authentic care. For example, your safety is important to us. Empathy helps the individual feel less alone and more supported, even in moments of high stress. Next slide. So, in crisis response, assessing risk is not a one-time task, right? It's a continuous process that helps us determine whether to continue engagement, bring in additional support, or withdraw for safety. And so, let's break down each of these components. Different populations experience crisis in different ways, right? And recognizing their unique triggers helps us prevent unnecessary individual escalation. So, for individuals on reservations, disrespecting tribal authority or cultural norms can quickly increase distress and distrust. For people with developmental disabilities, again, that sensory overload can lead to agitation. For individuals with substance use disorders, withdrawal symptoms, cravings, intoxication, they can create agitation, fear, or impulsive behavior. And for people experiencing homelessness, threats to personal belonging or being forced to relocate can be highly destabilizing. Next, we look at behavioral cues, right? What the person says, does, or expresses physically. Those verbal indicators, those nonverbal indicators, and psychological indicators. These signs tell us that the individual's emotional state is changing and may be approaching crisis. And then the environment, that like we've talked about, right? It plays a major role in escalation. Stressful surroundings can intensify fear or irritability, right? Crowded or chaotic settings, lack of privacy or safe space, the presence of bystanders or uniformed law enforcement. Adjusting the environment can really significantly lower risk. And there are moments when we know that the situation is moving from agitation to potential harm, right? A rapid shift from verbal agitation to physical aggression, attempts to assess weapons or nearby dangerous objects, or behaviors suggesting self-harm or direct threats towards others. When these indications appear, it may be necessary to engage co-response partners or withdraw to ensure safety. And then risk assessment's dynamic, right? It must evolve with the situation. We have to continuously ask, has the risk level changed? We want to use team check-ins and we want to document key observations. Staying alert, adaptive, and collaborative helps prevent harm and really supports safe decision making. Next slide. When responding to a crisis, deciding when to involve additional partners is a critical part of ensuring safety, cultural responsiveness, and appropriate support. Different populations require different forms of specialized assistance. And you see that outlined here, when we're talking about for individuals on reservations, we might involve tribal law enforcement or tribal health or behavioral health services in certain situations, right? We want to respect tribal sovereignty and partnering with culturally grounded providers. That strengthens engagement. For individuals with developmental disabilities, we might involve caregivers or family members, developmental disability crisis teams. That engagement can, help provide more tailored communication, calming approaches, and involving specialists prevents escalation, improves safety. For individuals with substance use disorders, we might involve medical professionals or EMS, harm reduction outreach teams, Substance use carries medical risks, and so involving medical and harm reduction partners ensures appropriate and compassionate care. And then for individuals who are homeless, perhaps involving homeless outreach teams, crisis is often tied to unmet basic needs for individuals experiencing homelessness. And so engaging the right partners helps address root causes and reduces repeated crises. Next slide. And then when responding to a behavioral crisis, a trauma-informed approach ensures that every action we take promotes safety, dignity, and trust. And so let's just talk briefly about some core trauma-informed principles. Prioritizing safety and dignity, right? Our first responsibility is to ensure the individual feels both physically and emotionally safe. Safety and dignity are a foundation. Transparency and choice. Trauma often involves a loss of control. Restoring choice helps individuals feel grounded and respected. Avoiding re-traumatization. We must be mindful of actions or language that could trigger past trauma. And then cultural and historical sensitivity. Trauma does not occur in a vacuum, right? Cultural identity and history shape how individuals experience crisis and perceive responder interventions. Collaborative engagement, trauma-informed care is it's not about controlling the situation. It's really about working with the individual. Collaboration helps to build trust. And then trauma-informed response extends beyond the immediate moment. Post-crisis follow-up helps individuals feel supported rather than abandoned. Next slide. All right, now we're going to do some rapid fire chat scenarios. So this is an interactive exercise to practice applying trauma-informed adaptations in real-world situations. And so I'm going to walk through each one. And the question for you is, what trauma-informed adaptation would you make? So first scenario, you were called to a crisis on tribal land. The individual is highly agitated and refuses to speak with outsiders. Tribal police are present, but waiting for your lead. Take a moment, think about cultural factors, historical trauma, and trust building. What's a trauma-informed adaptation that you would make in this scenario? I'll look in the chat. All right, as I'm waiting for responses, I'm actually going to keep moving because I know we're near the end here. Our second scenario is a young adult with autism is in a crowded shelter, covering their ears and shouting. They resist verbal instructions and appear overwhelmed by noise. Um, what's a trauma-informed adaptation you might make in this scenario? And then substance use disorder, an individual experiencing withdrawal is pacing in a public park, yelling at passerby. They refuse offers of food or water and appear increasingly aggressive. Again, trauma-informed adaptation you might make here. I see a response. Hold on a second. For development, relay messages through tribal police. Excellent, thank you. For individuals with developmental disabilities, move them to a calmer location. Yes. And then for, yeah, second scenario, step outside to a different room. Great. Yeah, so for the individual on a reservation, right, you're going to think about cultural factors, historical trauma, trust building, as I mentioned. For individuals with developmental disabilities, you're going to consider their sensory needs, communication style, and environmental adjustments. For individuals with substance use disorders, you're going to think about harm reduction, medical risk, safety strategies. Um, Yeah, I think I covered all that. Yes. So thank you for those of you who responded, right? Scenarios just show how quickly crisis context can shift and how essential it is at times where you might need to adapt your approach based on the needs in the environment. We're going to move to the next slide because we are closing up. So, as we wrap up today's training, I just want to briefly highlight the references and resources that informed the content that we've covered. If you'd like to explore any of these materials further, feel free to do so. You have the links on the next slide. I invite you all to join us for the next monthly convening of Mississippi Crisis System Partners. It's next Wednesday, December 10th, 17th at 10 a.m. Central Time. I hope you will join us. On the next slide, I just want to highlight some additional training opportunities available through the Department of Mental Health. There's several new training models that are underway that will be added to the DMH library soon. And then there's also several trainings already available for on-demand viewing on DMH's YouTube channel. Um, and then finally, just a reminder to follow DMH on social media for the latest resources and training opportunities. Thank you all for being here, for your time, your engagement, and your commitment to safe crisis response care. Thanks again. Have a great day.